World Health Organization guidelines on home-based care, which we adopted. As part of our strategy to combat COVID-19 virus, we had quite a number of skeptics who questioned the value of this program. But I'm sure by now, with the successes we have seen, we have been vindicated. In the last 1 week alone, a total of 2,738 patients placed under home care-based program have recovered from the disease. There are still many more who are currently placed under the program, and we want to wish them quick recovery. This is a major success in the fight against the disease, a disease that has ravaged our country and put the lives of many Kenyans at risk. Even as we continue to ramp up other measures to curtail the spread of the virus, the success of the home-based care program for those infected has given a whole new impetus in this fight. As our top medical personnel have continued to explain on the details of the home-based care program, we shall continue to emphasize to our people the need to embrace this program. This is because it is a far much cheaper and better option towards the recovery of a patient for all of those who are asymptomatic, as opposed to being admitted and held in a hospital facility. To begin with, as we have always indicated, about 90% of our COVID positive cases are asymptomatic, who can therefore be managed from home. This means that our facilities will have to care for the remaining 10% of COVID positive patients, those that will need hospitalization being those with moderate, severe, and critical disease. More importantly, the home-based care program will free up our health facilities to provide the usual care for all other patients with diseases other than COVID-19. When managed from home, the asymptomatic cases would have the better home environment, which psychologically enables them to recover faster and resume their normal lives. This gives the answer to the high number of recoveries from the COVID-19 since we launched this program about 2 months ago. It is also more cost-effective because it is cheaper, noting that 80% of the amount of money spent by a patient in a facility that cares for COVID-19 goes towards the purchase of personal protective equipment used by healthcare workers. So you can see that a large portion of the costs that go into care are actually costs that go towards protecting healthcare workers by providing them with these PPEs and other protective equipment that are quite costly. Ladies and gentlemen, in the past few weeks, we have seen a steady increase in the number of our positive cases. And this is something that worries all of us. Of particular concern, the rising numbers in our capital city and the county of Nairobi is a matter that we need to be very concerned about. While initially the coastal town of Mombasa was recording higher cases, but we have seen that since then the numbers out of Mombasa have begun to stabilize and maybe even begin to fall. This is good news, considering that the coastal town is among our major tourist destinations and the gateway to the East African region. Clearly, the measures in place there are working, and this needs to be encouraged. The coastal people must not let their guard down if their numbers are to continue to drop. And we want to thank the people of Mombasa for the strict observance of the containment measures that has seen their numbers stabilize and begin to fall. Nairobi, as I stated, and you know, over the last few days, a larger number of positive cases are coming from Nairobi. But apart from Nairobi, there is now focus shifting to counties neighboring the larger metropolitan area, namely Kiambu, Machakos, and Kajiado. Kiambu, for instance, has been recording a steady rise in infections. We are appealing to residents of these counties to strictly adhere to the containment measures for the spread of the virus to be under check. In the last 1 week, Kiambu has recorded 274 cases, compared to Mombasa, which has recorded 85 cases during the same period. If Mombasa can do it, then Nairobi, Kiambu, and Machakos can all do it. The whole country can do it, and it is possible. Let us ensure that those measures that have been put in place are adhered to. Let us ensure that our people understand the problem at hand and the need to observe these containment measures. We cannot relax or relent in this effort. And we are seeing that since the easing of some of the restrictions, we see Kenyans beginning to relax and beginning to move back to life as though it was normal. It is not normal. If we fail to observe these containment measures and take personal responsibility, we will see our numbers rise. Ladies and gentlemen, there is need for Kenyans to exercise individual and civic responsibility as the first step to deal with the virus. The safety of each and every one of us lies with an individual before it spreads to the society. If one stays safe, then the entire society will eventually be safe. Fellow Kenyans, if I now move on to our COVID-19 situation in the country, over the last 24 hours, we have 637 new cases of COVID-19, following the testing of 4,275 samples. Our total number of positives is now 14,805. And the total number of tests that we have conducted is 254,273. Of these 637 positive cases, all are Kenyans with the exception of 14 who are foreigners. We still see the skewed distribution between males and females. 361 of these are males, 276 are females. Again, no distinction in terms of the age of those who are found to be positive. Among these, the youngest is a 1-year-old infant, and the oldest is 88 years old. The new cases are distributed in the counties as follows. Nairobi recorded 342, Machakos 85, Kajiado 57, Kiambu 51, Nakuru 22, Mombasa 17, Nyeri 13, Busia 10, Muranga 9, Uasin Gishu 6, Bomet 5, Kericho 3, Kisii 3, Marsabit 2, and Narok, Vihiga, Meru, Embu, Garissa, Homa Bay, Kakamega, Kilifi, Kirinyaga, Kisumu, Kitui, and Laikipia have 1 case each. I'll just give you the breakdown of by sub-counties in Nairobi, since that's where we have the largest number. We have recorded 342 cases in Nairobi, as I mentioned earlier, and these are from Kamkunji, 44, Westlands, 32, Langata, 31, Embakasi South, 26, Dagoretti North, 24, Embakasi East, 24, Kasarani, 23, Embakasi West, 19, Kibra, 18, Makadara, 17, Starehe, 17, Ruaraka, 14, Embakasi Central, 13, Embakasi North, 11, Roysambu, 11, Mathare, 10, and Dagoretti South, 8. Machakos, with 85 cases, is distributed between these sub-counties of Athi River, 73, Machakos, 11, and Kangundo, 1. Kajiado's 57 cases are from Kajiado North, 25, Kajiado East, 20, Kajiado Central, 10, and Loitoktok, 2. And in Kiambu, the 51 cases are from Kabete, 12, Kikuyu and Thika, 7 each, Lari and Ruiru, 6 cases each, Gatundu, 5, Kiamba, 4, Limuru, 2, Githunguri and Juja, 1 case each. The breakdown of the other counties is provided in the document that you will receive. On a positive note, as I earlier told you, we are continuing to witness many recoveries, particularly from the home-based program, home-based care program. Today, 499 patients have recovered, out of which 406 are from the home-based care program, while 93 have been discharged from the various hospitals where they were receiving care. This brings the total number of recoveries to 6,757, and we want to express our gratitude to our healthcare workers for this commendable work that they continue to do under very difficult circumstances in the front lines and within our facilities. At the same time, unfortunately, we have lost 10 patients from the disease, bringing our total losses to the disease, in deaths to the disease, to 260. Our heartfelt condolences to those who have lost their loved ones. As I conclude, let me touch on a few trending topics. It has been noted that some bars have opened for business under the guise of eateries. Fellow Kenyans, I want us to note that according to the restrictions that were put in place, bars have not been opened. Bars and pubs remain closed. There was no lifting of that ban on bars and pubs. No bars have been licensed to operate, and anyone contravening the law will have to face the consequences. We have noted that what is happening out there is that eateries are also acting as bars at the same time. And equally, bars are pretending to be eateries so that alcohol can be consumed in these places. There are very clear, laid down licensing regimens for bars that serve alcohol and for eateries. Very clear licensing regimens. And we want to caution those who are operating under those guises that those licensing procedures are very clear, and any establishments found to be contravening that will face the full force of the law. Finally, another matter that has been out there And I would like to inform you that there is no such thing as a cabinet lockdown as we have seen in the news. I too read the news in the newspapers, and I could see that the lockdown was being surmised from a fact that there was a circular that came out of the office of the head of public service. The purpose of that circular was simply to reinforce the measures that the government has put in place for civil servants and public officers to observe. That was its purpose. And there has been no determination of a lockdown. Government must function. Government officers must function. And if you remember, we have said that essential services must continue. I think you will agree that government and functioning of government is an essential service. So there is no such thing as a cabinet lockdown. Finally, I would like to inform you that this morning we also launched 2 key documents. We launched these 2 documents, the Kenya Essential Medicines List 2019 and the National Antimicrobial Stewardship Guidelines. Both these documents are very key and instrumental in our COVID response. So their launch has been very timely, and we expect that the adoption of the information within these documents will be able to support our COVID response as we go through this period of the pandemic. And for these documents, I would like to express our gratitude to the USAID MTAPS program, REACT organization, and other stakeholders for their support in the development and subsequent dissemination of these guidelines. These documents will go a long way in supporting the successful delivery of stewardship interventions across the entire healthcare system. Thank you very much.
Good afternoon. My name is Purita Museo from KBC. With high number of cases being reported during the daily briefings, most Kenyans would expect a lot of target testing and contact tracing should be going on, but Kenyans are asking, they are not seeing such tests going on, especially in Nairobi, where it's been leading with cases reported on a daily basis. Where are these tests being conducted? And number 2, since the KEMRI stopped testing Kenyans, and Kenyans can no longer walk into any of these institutions for testing, where do they go for testing, especially those willing to pay for these services? Lastly, to the DG, we've seen yesterday and today, we've seen a high number of fatalities being recorded in the country. What could be the reason? Does it have anything to do with the low temperatures being experienced currently?
Thank you. Mark Namaswa, KTN News. I have a question concerning reports that our investigative desk has obtained from the Nairobi remand prison to the effect that about 200 inmates have been infected by COVID-19. Thank you.
Helen Aura from NTV. We understand that the British government has given us funds in terms of our research. We want to know, as a country, how far are we in terms of our research pertaining COVID? The second question, we also understand that diet is very important in combating COVID-19. Thus, we want to know, before one can be able to contract COVID-19, how can one be able to manage their diet to avoid getting infected? And as you said, the home-based care has been very successful, and these are patients who maybe most of them are symptomatic. What diet did you put them under so that which helped them get cured? Thank you.
I'm Haemba from Ebru TV. Waziri, I understand before the cessation of movement was actually lifted, you did cite some of the countries that experienced exponential increase of the cases after they reopened their economy without some sort of, without proper planning. Maybe as a country, Kenya, do you regret, because you understand after the cessation of movement was actually lifted, we are experiencing high number of the cases. Do you as a government regret? And then on the issue about that you have said about the lockdown of the cabinet, in the last about 3 days we have experienced about the cabinet secretaries touring the western part of Kenya, a move that has escalated into kind of a political rally in the region. So you say that, okay, the CSS should actually continue mingling with the Kenyans in an event that has turned out to be so political, where thousands of the Kenyans are actually attending such forums. And then finally, ni hii mambo ya wagonjwa ambao baadhi ya Wakenya wanaosema ambao wako katika hali hatari ya kuambukizwa virusi vya corona, hasa wenye ugonjwa wa kisukari na wale wa hypertension na hata virusi vya ukimwi. Je, naomba kujua iwapo kama serikali imeweka mipango yoyote ya kuweza kuwasaidia wagonjwa kama hao.
Okay, thank you very much. In terms of testing and whether we are doing targeted testing and contact tracing, and I think yesterday, I don't know, Purity, if you were here yesterday, but yesterday we had a similar question that I responded to. If you look at the numbers that we are testing, like today we have reported over 4,000 samples tested. These samples come from a variety of activities, and many of these activities are largely targeted testing, targeted to certain areas, as well as contact tracing and where the contacts take us. So we are continuing to do targeted testing and contact tracing. Maybe Kenyans may not know about this, we may not see them, but it is continuing and it goes to several areas, even within the community in some localities. Our teams are out there testing and collecting these samples that are tested and which we report every day at this point. So testing is still going on. And KEMRI, you said stopped testing. KEMRI did not stop testing. What KEMRI did stop is sampling of those who are seeking to be tested being done within their facilities. And that could be because of security reasons and reasons of trying to minimize the potential of spread of the virus. But samples are still being collected. Some of these samples that are collected are tested in KEMRI lab facilities. So we are still testing, and KEMRI continues to test. Now, whether those who need to be tested want to be tested in public facilities where we are not charging for that. If the government is sampling and testing, there is no charge for that. There is the other option that there are private facilities that are offering these services for a fee. And a number of the public, those who can afford, do actually go and seek testing in these facilities that we have approved for them to do testing of COVID-19. DG, the second question is yours. You will respond to it. The association, any association whatsoever between the cold season that we are experiencing and the rise in numbers. I want to say to that if we look at our trajectory and the way our numbers have been increasing even before the lockdown, and earlier on we had even made projections that going forward we would continue to see a steady rise. So some of the numbers that we are seeing, of course, seem to be consistent with what we had projected would happen, that these numbers would rise. Whether now they have taken a steeper curve because of the easing of lockdowns, I think is something that has not yet been firmly established and determined, but we are looking at that data and we want to see whether any of these is associated with the with the easing of restrictions. We are carefully monitoring what is happening. Remember, it was on July the 7th, correct, that the president eased some of these restrictions. We are now about 2 weeks into it. Let's watch and see what happens in the next 1 week. Mark Lamwasa, Nairobi Remand Prison. Again, I think that question is for the DG to respond to the situation in the Nairobi Remand Prison. Helen Awo, research on COVID-19, supported through the UK government. I think you are referring to the virtual conference that took place today between the Secretary of State of UK and our leadership in the ministry. Again, in the context of the long-term partnership that we have enjoyed with the government of the UK, and especially in the area of research. You are aware that we have the presence of the Wellcome Trust Research Program at Kemri in Kilifi. That is part of the Oxford University. We've been here for very many years conducting research on infectious diseases within the country. In that context, yes, we continue to work together, and some of the recent research that has been mentioned is specifically the study on COVID-19 and trying to understand the epidemiology of this study, particularly in terms of the immune response. And we have conducted, continuing to conduct, a surveillance study. In other words, looking throughout the country and trying to understand what is the level of exposure of Kenyans to this virus. This is information that can be gathered by looking at the immune responses that one may have mounted. You look for antibodies against the virus in people. If you find those antibodies, and there are the tests that detect that, these are the rapid diagnostic tests we have talked about before, they detect that exposure. So that serosurveillance study is ongoing. The information that we have gathered from it right now, we have shared with you before the preliminary information. It is a large-scale study that is continuing to expand as we collect more samples, but based on blood donor samples that have been collected from many parts of the country and that to some extent represent the population that we are looking at, we do know that certain areas, for example in Nairobi, which is a hotspot, that the seroprevalence data indicates that maybe at least 5% of the population of Nairobi may have been exposed to the virus from antibody data. That is work in progress. As it develops, we shall be able to share with you. But it is very important work because it tells us what is the level, what is the prevalence of the serology, positive serology in the country. This then guides you to those areas where the virus has hit and may still be circulating. So it will inform our strategies in the COVID response. The other area that we are working on closely with that group in Wellcome Trust and Oxford University is the vaccine that is being trialed in the UK. There are discussions that we, as Kenya, could possibly participate in that trial. And that vaccine seems to have shown some promise in phase 1 trials that were carried out in the UK. Finally, Khaemba, countries spike after opening. The issue of the spike in countries after opening up, easing restrictions, I think it's always expected because the virus spreads through contact and through mobility of people. So the moment you do relax your restrictions, you will expect that there will be more transmission. And when those measures are being put in place, it is not because of ignorance of the policymakers of the fact that there will be some transmission, but it is because of the delicate balance that needs to be maintained between controlling the virus and enabling livelihoods to continue. And you can see now many countries have gone through switches between opening, monitoring, closing again, opening, closing, up. And that is the epidemiology of this disease, and it is likely that that is what may happen in many countries going forward. And finally, of the issue of cabinet lockdown, or that cabinet secretaries may not be able to travel. I think I have talked about that, but let me say, when I say that there is no restriction, it does not give cabinet secretaries any free license to go out there and do things that are contrary to the measures we have put in place. In fact, as leaders and people in positions, it's our duty to lead by example and to show that we do follow the measures that have been put in there. And I think all of us, not only leaders, must take that responsibility and must demonstrate that responsibility out there in the public. So it doesn't mean that by somebody going out there to, go about the normal business of government, of inspecting development projects or other things out there, they must observe the measures that have been put in place, and they must lead by example. The issue of underlying conditions, I think this is a subject we have talked about severally. I'm sure the DG will also touch on it, but it's a fact that if you are above a certain age, say 60 and over, you're already a vulnerable group. If you have underlying conditions and that age factor, you're even more at risk. So the recognition that this is a special group of people that need special attention and special protection is something that the government has been pushing forward. If you remember, even as travel restrictions were being eased, our appeal was to those people who want to travel back to the rural areas where the old people are, is to refrain from it if they can. And if they do, to exercise the caution of not transmitting this virus to their loved ones out there. And we are paying special attention to this group, even in our programs, as we target them for protection, because we know this is the vulnerable group that are likely to be adversely affected by this disease. Thank you. Let me ask the DG now to respond to the questions directed at him.
Oh, thank you, Waziri. I'll start with the last one of the comorbidities that was asked by Mr. Hayamba. Of Ebru TV, yes, the risk factors, of course, for severe COVID disease are well known to us, and this is now our own locally generated data, with a combination of hypertension, diabetes accounting for 32% of the cases, hypertension alone accounting for 17% of the cases, diabetes on its own 15% of the cases, chronic lung disease and cancers each account for 10%, and HIV accounts for 5% of the cases of severe COVID disease. And these people are at an increased risk of mortality. And to this end, we have worked out on guidelines to ensure continuity of services for non-communicable diseases, including hypertension, diabetes, but also for other services, including HIV, TB, to ensure that these people receive optimum services and their conditions are properly controlled, therefore reducing the risk of contracting severe COVID disease leading to mortality. And if you looked at our data in the past 2 or so months, the number of patients who are coming for healthcare services has increased significantly, which is a sign of confidence that even if you go for healthcare services, because of the measures that you put in place, you'll be able to receive appropriate services without putting your life at risk. Purity asked about the fatalities, whether they are related to weather. Kenya now is number 9 in terms of disease burden of COVID-19 in the African continent. Of course, number 1 is South Africa with more than 240,000 cases. We are now doing 14,000, heading to the 15,000 mark. After South Africa, of course, is Egypt, followed by Algeria, Nigeria, Ghana. So far, there is no direct correlation between the weather pattern or the temperature in a particular place and the mortality. For example, now Brazil is recording the second highest infection rates and mortality, yet Brazil is a tropical country like Kenya. America has moved away from the winter, spring, I don't know which season they are in, and the deaths have continued to rise. So the temperature, there's no direct correlation between the temperature of a particular place and the burden of the disease and mortality. What is important, of course, is for all of us to be able to put into place the infection prevention control measures, which we continuously articulate in our presses to be able to protect yourself from COVID-19 disease. There was a question about Nairobi Remand Prison. Yes, prisons from the word go are identified as one of the high-risk areas for potential outbreak of COVID-19 disease because of the high population of the inmates, because of poor ventilation in the housing facilities they have, because of the poor water sanitation and hygiene facilities that are available. And you remember the first edict that His Excellency the President read was stopping visitation to prison, therefore reducing that risk. But of course, notwithstanding, once you have community transmission of COVID-19, and of course, warders who serve in the prison, some of them stay outside, suppliers have to come and visit the prisons to bring provisions, the risk therefore still stands. I may not be able to comment categorically on the number of prisoners who have tested positive for COVID-19, but for sure there are prisoners who have tested for COVID-19 in Nairobi Remand Prison and other prisons. And it is with this in mind that we have worked very closely with the State Department of Correctional Services to ensure that we put into place measures to contain the spread of disease in correctional centers. It is with this in mind that we have done capacity building in all our prisons. We have supplied them with personal protective equipment. We have provided through the State Department of Correctional Services additional wash facilities, and of course release of petty offenders to be able to congest the prisons. This has not only been done in Nairobi Remand Prison, but in all prisons all over the country. The final one was about diet. Yes, of course, like any other condition, of course, we recommend that you have a wholesome diet made up of all food groups, including the micronutrients from fruits and vegetables, which are important in enhancing your immunity. So we encourage everybody else, not only those who are suffering from COVID-19, but everybody else to be able to ensure that they have a healthy, balanced diet. But on top of that, of course, you need to remember the infection prevention control measures. Taking a well-balanced diet without washing hands, without wearing your mask, without keeping physical distance will not protect you from COVID-19 disease. It is good to have a wholesome diet, but remember infection prevention control measures are very paramount for you not to get COVID-19 disease. But in case you get it and you have a balanced diet, the different food groups will work together to ensure that your body is able to sufficiently fight that disease and ensure your recovery. Thank you.
Thank you.